Is hormone pellet therapy safe after breast cancer? When I started providing hormone pellet therapy in Utah over 2 decades ago, breast cancer was still pretty uncommon. While for good reasons it is rare for women on hormone pellet therapy to develop breast cancer, those who do not have bioidentical hormones are experiencing it at an alarming rate. You may be one of these women feeling as if you're between a rock and a hard place. On the one hand, you know you desperately need hormones for your health and well-being, but you're terrified of your cancer coming back. This fear, unfortunately, stems from well-meaning but ill-informed people around you. You may have been taught one of the following myths. Number 1, hormones cause breast cancer. This myth stems from the discovery that many breast tumors make more estrogen and or progesterone receptors to stimulate their own growth. All cells have estrogen, progesterone, and testosterone receptors on them. This is because these hormones are essential for the optimal function of the human body. Once a toxic environment triggers conversion of a healthy cell into a cancerous cell, that cell may multiply the number of estrogen and or progesterone receptors on its surface in order to increase its growth. If this is the case with your tumor, we don't want to risk stimulating it by giving you these hormones. But this does not mean hormones caused your cancer. If this was truly the case, women would have the highest risk of triggering breast cancer during pregnancy, which is actually very low risk time period. Moreover, women have had estrogen and progesterone in their bodies for thousands of years, whereas breast cancer has only become a common health concern during the last century. Number 2, hormones are unsafe once a woman has had breast cancer. This myth stems from the failure to identify terms. To even imply that all hormones are unsafe in this setting is no different than saying all drugs cause heart failure. Testosterone is a hormone, arguably the most important female hormone, and has been shown to kill cancer cells. Any woman with estrogen receptor positive breast cancer can confidently take testosterone, knowing that if it has any effect on her cancer at all, it will be a beneficial one. That is, as long as the testosterone is coupled with a special agent that blocks conversion of testosterone into estrogen. Number 3, estrogen can cause a tumor to come back. This myth stems from the misunderstanding of cancer activity. If your cancer is truly gone, the only way it is going to come back is if the original triggers and contributing factors have not been identified and resolved. But many cancers are not truly gone in the first place. They may be declared to be in remission, but that is not the same as being gone. This is because it takes somewhere in the neighborhood of 1 billion cancer cells in one place to show up on conventional imaging tests, like mammogram, ultrasound, and MRI. If cancer cells escaped from your tumor through the bloodstream before the tumor was discovered and removed, you already have metastatic cancer. You just won't know it for another 5 to 10 years, which is how long it will take for enough of those cells to accumulate in one place and become detectable on a scan. In the meantime, you'll either live in fear waiting for the other shoe to drop, or blissfully go about your business thinking you've been cured. The solution is simply to measure your circulating tumor cells. If you don't have any, then you don't have to worry about any risk from estrogen. If you do have circulating tumor cells, then you'd be smart to get some testosterone on board while undergoing a metabolic cancer program so you don't have any surprises in 5 to 10 years. If it's been 10 years since your treatment, chances are pretty slim that you'll experience recurrence, unless you have some really lazy cancer cells. If it's been 5 years, your risk of stimulating leftover cells with estrogen replacement is greater, but still not huge. The good news in this case is if you take estrogen, you'll find out sooner that your cancer wasn't actually gone, giving you more time to do something about it. But it's always a safer bet just to get tested for circulating tumor cells and get to work on them if they are found. The bottom line is that hormone replacement is both appropriate and life-saving whether or not a woman has or has had breast cancer. The problem you face is that doctors have passed traditions down from generation to generation that do not stand up to scientific scrutiny. It's completely well-intentioned. They are legitimately terrified of being responsible for a woman getting her cancer back. They just never questioned what they were taught by their venerable professors in medical school and don't have the time to study the science for themselves. As a result, they will continue to put the fear of God into countless women, completely unaware that they are shortening women's lives with heart disease, diabetes, dementia, stroke, osteoporosis, and more. You deserve better. At Prestige Wellness Institute, you can come to a better understanding of how your body works, what it needs, and how you can live your longest and healthiest possible life.